I was first diagnosed at age 55. I had never been sick before. I was at lunch and I was talking, and I just kind of stopped in mid-sentence and just kind of stared. And my coworkers were waiting for me to finish my sentence. And fortunately for me, one of my coworkers knew what was going on. I was having a seizure.
What we heard from our focus groups was that people don't feel like there's enough information about epilepsy. They feel like they go to the doctor's office and aren't getting what they need to equip them to handle the condition.
From the beginning, when she started having the epilepsy, not knowing anything about epilepsy, not having a support group or anyone to give me advice as to what to do. Sometimes I've been scared to death.
The partnership between Morehouse and Emory came about through funding from the Centers for Disease Control and Prevention. We received a 5-year grant to study epilepsy in Blacks. Project UPLIFT is a program and intervention that's been shown to be effective in reducing depressive symptoms among people with epilepsy.
I had to see her go through certain things, depression. All of that makes you very fearful, even when she gets the attacks. That in itself is very scary.
Project UPLIFT is designed to teach mental health skills to a wide range of people, but to do it at a distance over the telephone.
Georgia law requires that when a person has a seizure, you cannot drive for 6 months.
So they're a population who can't get out, who have high rates of depression. And so Project UPLIFT is a natural fit for this population.
Morehouse School of Medicine has a history of being connected with the community. And so our first order of business was to engage the community to see if Project UPLIFT is culturally appropriate for African Americans.
It's really all about lack of access. They don't have access to primary care on a regular basis, therefore they're not going to have access to primary care for their seizures, they're not going to have access to a specialist for their seizures, so they use the ER as their primary care.
One of the things we wanted to do was to make sure that even though people who are African American were part of all the studies we did, they were always the minority of the people. And we wondered if we talked to African Americans straight on and said, what do you think about this program? If they would give us a different response.
They didn't see any need to make any changes to Project UPLIFT. But we needed to change our language. Advertising for people who are depressed, we wouldn't get many people. For example, our community advisory board told us that adults who have epilepsy don't see themselves as needing a caregiver, that they prefer the term support person because a caregiver implies that they are unable to take care of themselves.
Me always being very, very independent, having to ask for assistance. That's the hardest thing.
My hope by partnering with Emory University is that we will raise awareness about epilepsy in the Black community, but also reduce stigma and reduce depression among people with epilepsy.